201. Which cranial nerve is assessed by asking a patient to stick out their tongue? Answer: hypoglossal nerve. Explanation: the hypoglossal nerve controls tongue movement, assessed for deviation or weakness, a key component of neurological cranial nerve evaluation in clinical exams. 202. What is the primary nursing action for a patient with a suspected traumatic brain injury? Answer: monitor neurological status. Explanation: monitoring neurological status detects deterioration in traumatic brain injury, guiding timely interventions to ensure patient safety and prevent complications. 203. Which brain structure is primarily responsible for regulating hormone release? Answer: hypothalamus. Explanation: the hypothalamus regulates hormone release via the pituitary gland, critical for assessing endocrine function in neurological patients during clinical care. 204. What is the primary symptom of a patient with a stroke affecting the frontal lobe? Answer: impaired judgment. Explanation: the frontal lobe governs executive functions, so a stroke causes impaired judgment, guiding neurological assessments and patient safety interventions. 205. Which reflex is tested by tapping the triceps tendon? Answer: triceps reflex. Explanation: the triceps reflex, elicited by tapping the triceps tendon, assesses the C6, C7 spinal segments, critical for evaluating neurological motor function in the upper limbs. 206. What is the primary purpose of administering fosphenytoin to a neurological patient? Answer: control seizures. Explanation: fosphenytoin, a prodrug of phenytoin, controls seizures, a critical intervention to stabilize neurological status and ensure patient safety in emergencies. 207. Which cranial nerve is responsible for balance during head movement? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve's vestibular branch detects head movement, assessed for balance, critical for preventing falls in neurological patients. 208. What is the most appropriate nursing intervention for a patient with a Glasgow Coma Scale score of 6? Answer: ensure airway patency. Explanation: a score of 6 indicates severe impairment, requiring airway patency to prevent hypoxia, a critical safety measure in neurological emergencies. 209. Which brain area is responsible for processing emotional memory? Answer: amygdala. Explanation: the amygdala processes emotional memory, assessed to detect neurological deficits in behavior, guiding patient care in clinical evaluations. 210. What is the primary nursing action for a patient experiencing a myoclonic seizure? Answer: protect from injury. Explanation: protecting the patient from injury by ensuring a safe environment prevents harm during a myoclonic seizure, a critical neurological nursing intervention. 211. Which spinal segments are tested by the quadriceps reflex? Answer: L2, L4. Explanation: the quadriceps reflex, also called the patellar reflex, assesses the L2, L4 spinal segments, critical for evaluating neurological motor function in the lower limbs. 212. What is the primary function of the corpus callosum? Answer: connect cerebral hemispheres. Explanation: the corpus callosum facilitates communication between hemispheres, critical for assessing neurological deficits in cognitive integration during clinical exams. 213. Which cranial nerve is assessed by testing facial sensation with a cotton wisp? Answer: trigeminal nerve. Explanation: the trigeminal nerve provides facial sensation, assessed with a cotton wisp, a key test for neurological sensory function in clinical examinations. 214. What is the primary goal of physical therapy for a patient with multiple sclerosis? Answer: maintain mobility. Explanation: physical therapy maintains mobility in multiple sclerosis patients, a critical intervention to enhance neurological function and prevent complications. 215. Which brain structure regulates swallowing? Answer: medulla oblongata. Explanation: the medulla oblongata contains swallowing centers, critical for assessing neurological function to ensure safe oral intake in clinical settings. 216. What is the primary nursing intervention for a patient with facial nerve paralysis? Answer: provide eye lubrication. Explanation: Providing eye lubrication prevents corneal damage in facial nerve paralysis, a critical intervention for neurological patient safety and comfort. 217. Which cranial nerve is responsible for pupil dilation? Answer: sympathetic nervous system. Explanation: the sympathetic nervous system, not a cranial nerve, controls pupil dilation, assessed to evaluate neurological autonomic function in clinical settings. 218. What is the primary symptom of a patient with myasthenia gravis? Answer: muscle weakness. Explanation: muscle weakness, worsening with activity, is caused by acetylcholine receptor dysfunction, guiding neurological assessments and safety measures. 219. Which reflex is tested by tapping the Achilles tendon? Answer: Achilles reflex. Explanation: the Achilles reflex assesses the S1, S2 spinal segments, a key deep tendon reflex for evaluating neurological function in the lower limbs. 220. What is the primary purpose of an angiogram in a neurological patient? Answer: visualize cerebral blood vessels. Explanation: an angiogram visualizes cerebral blood vessels to diagnose conditions like aneurysms, guiding neurological treatment and ensuring accurate patient care. 221. Which cranial nerve controls lateral eye movement? Answer: abducens nerve. Explanation: the abducens nerve innervates the lateral rectus muscle, assessed for lateral eye movement, critical for detecting neurological deficits in clinical exams. 222. What is the primary nursing action for a patient with a suspected subdural hematoma? Answer: monitor neurological status. Explanation: monitoring neurological status detects deterioration in subdural hematoma, guiding timely interventions to ensure patient safety and prevent brain damage. 223. Which brain area is responsible for processing language comprehension? Answer: Wernicke's area. Explanation: Wernicke's area in the temporal lobe governs language comprehension, assessed for deficits like aphasia, guiding neurological communication strategies. 224. What is the primary purpose of administering topiramate to a neurological patient? Answer: prevent seizures. Explanation: topiramate, an anticonvulsant, prevents seizures, a critical intervention for stabilizing neurological patients and ensuring safety. 225. Which cranial nerve is assessed by asking a patient to smile? Answer: facial nerve. Explanation: the facial nerve controls facial muscles, assessed for symmetry during smiling, a key test for neurological motor function in clinical exams. 226. What is the primary symptom of a patient with a medulla oblongata stroke? Answer: vital sign instability. Explanation: a medulla stroke affects respiratory and cardiovascular centers, causing vital sign instability, guiding neurological assessments and emergency care. 227. Which spinal segments are tested by the biceps reflex? Answer: C5, C6. Explanation: the biceps reflex assesses the C5, C6 spinal segments, a key deep tendon reflex for evaluating neurological motor function in the upper limbs. 228. What is the primary nursing intervention for a patient with a history of status epilepticus? Answer: ensure access to emergency medications. Explanation: ensuring access to emergency medications like lorazepam prevents prolonged seizures, a critical safety measure in neurological nursing care. 229. Which brain structure is responsible for coordinating fine motor skills? Answer: cerebellum. Explanation: the cerebellum coordinates fine motor skills, assessed to detect neurological deficits like tremors, ensuring safe patient mobility and function. 230. What is the primary purpose of a neurological exam in a patient with head trauma? Answer: detect neurological deficits. Explanation: a neurological exam identifies deficits in head trauma patients, guiding diagnosis and treatment to prevent further injury and ensure patient safety. 231. Which cranial nerve controls pupil constriction? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls pupil constriction via parasympathetic fibers, assessed to evaluate neurological function in clinical settings. 232. What is the primary symptom of a patient with a parietal lobe stroke? Answer: sensory loss. Explanation: The parietal lobe processes sensation, so a stroke causes sensory loss, guiding neurological assessments and safety interventions like injury prevention. 233. Which brain area regulates body temperature? Answer: hypothalamus. Explanation: the hypothalamus regulates body temperature via autonomic responses, critical for maintaining homeostasis in neurological patients during clinical care. 234. What is the primary nursing action for a patient with a suspected spinal cord compression? Answer: immobilize the spine. Explanation: immobilizing the spine prevents further neurological damage in spinal cord compression, a critical safety intervention in emergency care. 235. Which cranial nerve is responsible for taste on the anterior tongue? Answer: facial nerve. Explanation: the facial nerve controls taste on the anterior two-thirds of the tongue, assessed to detect neurological sensory deficits in clinical examinations. 236. What is the primary purpose of administering levodopa to a neurological patient? Answer: improve motor function. Explanation: levodopa increases dopamine to improve motor function in Parkinson's disease, a critical intervention for neurological patient mobility and quality of life. 237. Which brain structure relays auditory information to the cortex? Answer: thalamus. Explanation: the thalamus relays auditory signals via the medial geniculate nucleus, critical for assessing neurological sensory deficits in clinical evaluations. 238. What is the primary symptom of a patient with a frontal lobe tumor? Answer: personality changes. Explanation: a frontal lobe tumor affects executive functions, causing personality changes, guiding neurological assessments and patient care planning. 239. Which reflex is tested by stroking the sole of the foot? Answer: Babinski reflex. Explanation: the Babinski reflex, elicited by stroking the foot sole, assesses upper motor neuron function, critical for detecting neurological abnormalities in adults. 240. What is the primary purpose of a shunt in a neurological patient? Answer: drain excess cerebrospinal fluid. Explanation: a shunt drains excess cerebrospinal fluid in conditions like hydrocephalus, a critical intervention to reduce intracranial pressure and ensure patient safety. 241. Which cranial nerve controls eyelid elevation? Answer: oculomotor nerve. Explanation: the oculomotor nerve innervates the levator palpebrae superioris, assessed for eyelid elevation, critical for detecting neurological deficits in clinical exams. 242. What is the primary nursing intervention for a patient with a history of migraines? Answer: teach trigger avoidance. Explanation: teaching trigger avoidance, like stress or certain foods, prevents migraines, a critical intervention to enhance neurological comfort and patient safety. 243. Which brain area is responsible for processing vestibular information? Answer: cerebellum. Explanation: the cerebellum processes vestibular input for balance, assessed to detect neurological deficits like vertigo, guiding patient safety interventions. 244. What is the primary symptom of a patient with a spinal cord injury at L1? Answer: paraplegia. Explanation: an L1 spinal cord injury causes paraplegia, guiding neurological assessments and interventions to support patient safety and mobility. 245. Which cranial nerve is responsible for the gag reflex? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve provides sensory input for the gag reflex, assessed to ensure safe swallowing in neurological patients. 246. What is the primary purpose of administering donepezil to a neurological patient? Answer: improve cognitive function. Explanation: donepezil enhances cognition in Alzheimer's disease by increasing acetylcholine, a critical intervention for managing neurological cognitive decline. 247. Which brain structure modulates gait? Answer: cerebellum. Explanation: the cerebellum modulates gait by coordinating movement, assessed to detect neurological deficits like ataxia, ensuring safe patient mobility. 248. What is the primary nursing action for a patient with a suspected cerebral aneurysm? Answer: maintain blood pressure control. Explanation: maintaining blood pressure control prevents aneurysm rupture, a critical intervention to ensure neurological stability and patient safety. 249. Which cranial nerve controls chewing? Answer: trigeminal nerve. Explanation: the trigeminal nerve innervates mastication muscles, assessed for chewing strength, critical for detecting neurological motor deficits in clinical exams. 250. What is the primary symptom of a patient with occipital lobe epilepsy? Answer: visual hallucinations. Explanation: occipital lobe epilepsy causes visual hallucinations, guiding neurological assessments and interventions to ensure patient safety and seizure control.